This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences, and the individual results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach. This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences, and the individual results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach. All right, hello and welcome everybody to Daily with Doc and Becca. Thank you so much for joining us here as we bring another hour of empowering information to help you help yourself, and then you can help others. My name is Becca Dukes. I am the hostess of this program. I'm also the Director of Student Services for the Institute of Holistic Health, where we empower others to learn about the 4 areas of health, how they are affected by nutritional deficiencies, solutions to correct those nutritional deficiencies, and we go more than just the nutrition. We look at all 8 areas of life as we are holistic in all that we do. So if you're interested in becoming a certified holistic health coach, we invite you to check us out. Go to coachwithdoc.com. That is coachwithdoc.com. Now, as we are going through life, we always seem to think of things that happen that are associated with growing older, getting into those golden years. Well, sometimes it doesn't just happen in the golden years. It seems to be happening more and more. And those are some of the things that we're going to be talking about today on Daily with Doc. Now, if you were invited to watch this program by somebody specific, they are going to be your first point of contact. Get back with them if you have any questions, and they will be able to direct you to find the answers. If they don't have the answers, they will find answers. And most of the time, if you are referred to this program by somebody specific, it is one of our amazing colleagues who have found the value in what we do for themselves and want to share it with the world. So we definitely want to make sure that you get back with them if you were referred by somebody specific. We are a resource for an amazing community. Now, if you have never spoken to anybody about Daily with Dr. Joel Wallach, a company called Longevity, and you would like to, we do have a call team standing by at 855-949-3377. Again, that's 855-949-3377. 877. Now, this is a live presentation. So if you're watching us on any of the live streams and you would like to join our live Zoom studio audience, you're more than welcome to do so by going to Zoom, ZOOM, dailywithdoc.com. That is zoom.dailywithdoc.com. And you can join us here in our live Zoom room Monday through Friday from 12 to 1 p.m. Pacific time. Again, that is Monday through Friday, 12 to 1 Pacific time. That is 1 o'clock Mountain, 2 o'clock Central, and 3 o'clock Eastern time. Now, without further ado, one of the amazing people that we have on this program, which actually started this whole crusade, is Dr. Joel Wallach. Now, Dr. Wallach started out as a young child who I believe was divinely directed to look at nutrition and how nutrition affects our health, good and bad. As a young child, he was struggling with a few different things. And as he was observant enough to look at the farm animals around them, what they were eating compared to what he was eating, and taking and throwing away some of those things that he was eating and going more towards what they were eating, he was able to overcome some of the challenges he was experiencing. And that's just the beginning. He then was able to take part in team sports and be successful in that. He went on to college and worked his way through college in a pathology lab, where he got a Bachelor of Science in Plant and Soil Sciences. He went on to become a doctor of veterinary medicine. His work in that pathology lab actually got him recognized and noticed by Marlon Perkins of Mutuals Omaha, and he was invited to be a lead pathologist on their expedition to save the white rhino in Africa. And that was just the beginning. After 2 years of being in Africa, he was then sent to Yerkes Primate Center. But I think somewhere in there, he was working with the different zoos around the world and finding causes of like liver cancer in bears, correcting that and eliminating liver cancer in the bears around the zoos around the world. And at the Yerkes Primate Center, he found the first non-human case of cystic fibrosis. Now, for those of you who don't know, cystic fibrosis was said to be a human genetic condition. Well, not only was it not solely human, but it was not genetic, because he found it in multiple different little monkeys that were not even related. And he linked it right back to their diet. But when he presented it, he was fired. And that sent him on another journey where he actually started teaching nutrition at a naturopathic college. He decided to become a naturopath. And that is when he became fully involved in making sure that humans knew the importance of nutrition. And not being able to find the nutrition on the market that he could stand behind, he put together a team, they formulated nutrition, and created the company that we now know as Youngevity. Now, he has stepped back from ownership and running the program. He's turned it over to his son and daughter-in-law, and now he can freely just share the information without anybody saying, well, you're only choosing this company because you make a buck. Nope, he's turned that over, and his income comes from the sale of his 25 publications now, 25 books, folks. He actually has 26. One of them's not available on his website, and that is held as a national treasure in the Smithsonian Museum. And it's this big bad boy, Diseases of Exotic Animals, Medical and Surgical Management. So without further ado, it is my honor and privilege to share with you and the world the doctor who helped me find why I was so sick and too young. You know, there's a saying called, I'm too young to feel this old. Well, folks, I was there. And thankfully, I found this doctor. I followed his recommendations. And now I feel younger at 53 than I did even in my early 20s. So, Dr. Joel Wallach, thank you so much for all that you have done to help us become the best that we can be and give us purpose and a mission to be able to help others as well. Now, why can I not find? Hold on. Maybe somebody can help me out. There we go. Thank you. So this is why we have a team where we work together and make this program possible. Hello, Dr. Wallach. Welcome to Daily with Doc.
Okay. Well, thank you, team. We're a family, and I can't thank each and every one of you enough for all the time you put in to help others. It's one of those miracles, and I don't know why I was chosen to understand what was going on, but I apparently was. And so I made sure that I've, what should I say, lived up to the responsibility that I was given. I didn't just forget it, and I spent my whole life on it. I'm 85 years old using the Chinese method of aging. They count your 9 months of pregnancy, okay, as part of your aging. So when you're born, you're 9 months old in China, okay? In America, when you say, well, how old are you? Well, I was born in, okay. But then in the Chinese, when they say, oh, I was conceived at, and I was born at such a time. And so I chose to go with the Chinese method because of Dr. Milan. And so I'm 85 using the Chinese method, and very soon it'll be 86. So at any rate, very good, thank you. And today I want to talk about something common. You kind of touched on some of the pieces that are involved here, and that is that the doctors in many cases don't go after the cause of the disease. They just treat the symptoms and make the patient happy. And as long as the pain goes away, they lose 20 pounds, they're happy. They're still going to die young because it didn't really get rid of the disease. It would just get rid of some of the symptoms. And that's what I was able to see in the pathology lab. And it's really crazy. I'm seeing all this stuff going in there. And the one that really, really got me was when kids would die, okay, in their teens and pre-teens and so forth, is because they were missing nutrition. Well, they were getting, breastfed, they were getting their formulas. Well, that doesn't work if that's all you do, okay? The mother's got to be taking prenatal vitamins before she gets pregnant. If not, the baby could be messed up. And by the time they're a little girl, they look like a little girl, they say, I'm a boy. Or by the time they reach being a boy and they look like a boy, they say, I'm a girl. That's not the kid's fault. That was because the mama wasn't taking vitamins and minerals prior to conception, okay? Then, of course, one of the most common issues in all vertebrates, all mammals, including humans, is osteoporosis and arthritis. When you get osteoporosis of the skull, which I'm the guy that sort of put the light on it, okay?
I've got the book here for you, Doc.
Hmm?
I'm getting that page up for you right here.
Page 6.
So yep.
Page 6, okay? It's only
I got it.
And, this is one of the biggest, most common things, as Rebecca pointed out, okay? You can have...
Put yours down, Doc. Doc, go ahead and put yours down so we can hear you clearly, please.
Okay. You can be born with arthritis. You can live to be 100, 120, 130, 200 with arthritis. Same with osteoporosis. But you're going to have terrible pain. It's going to, which restrict your motion and getting around, that kind of stuff. And you can have some fractures that will make you have to use a cane and a walker and so on. But you can live with all this pain and inflammation, use an herb and put some cream on your joints that are painful and so forth. But I really, really learned this with Theo Ratliff, a great basketball player, whose career was over because he had terrible arthritis in his hips and his knees, and they wanted to give him artificial knees, and he wouldn't be able to play basketball anymore. They would put him on the team with artificial knees. And so he says, no, I'm just going to retire and coach or do something like that. One of his teammates called me and said, "Can you help him?" I said, "Yeah, no problem." So I put together our Healthy Start Pack, which was our 90 essential nutrients, and added our glucogel to it, okay, and called it the Healthy Bone and Joint Pack. And the glucogel replaces the old stuff that people used to do by actually using what?
Boiling bones on the stove overnight
What?
and creating bone broth.
Bone broth. There you go. Bone broth. People were using bone broth for thousands of years. They'd boil bones in water with vinegar in it overnight and drink it the next morning. They were getting the minerals that came from the bones. Okay, it was called bone broth. It was used for centuries. Okay, well, we were the ones who replaced bone broth. Okay, because in 3 o'clock in the afternoon, Monday, September 4th, 1882, everything kind of disappeared because they flipped on the switch for electricity. And for thousands of years, human beings had been using wood ashes and coal ashes for making food taste good, okay, spices. They also used wood ashes and coal ashes in their gardens as a fertilizer because it had vitamins and minerals in it. And when we went to electricity, there was no more minerals available to feed the general public. So we came up with a Healthy Bone and Joint Pack, which is our Healthy Start Pack, and the glucogel, which I created. and so to make a long story short, in 3 months, Theo got rebuilt. He got his position back with the basketball, but he still was kind of wearing out halfway through the game. So we came up with a rebound or a sports drink. Okay. They come in a box like this, a rebound. There we go. Okay. There's 36 in a box. So if you use it twice a day, you'll need 2 of those boxes. And the sticks look like this. You cut the corner off of it and put it into a bottle of water. Not the whole thing, just the powder that's in here. Okay. And you'll get your drink that has the energy in it, okay, and also help maintain bones and joints, that kind of stuff as well. So with all that said, it's one of those things where we're going to talk about arthritis. Is it worth talking about? Well, let's just look at that. That's a good question. This is from the U.S. government, not me. This is from the U.S. government, published this about 3 years ago. I'm sure it's worse now, but let's just go with from 3 years ago. They said that each year in America, we spend, by treatments from doctors, $626.8 billion a year just to treat arthritis symptoms, not to prevent it or cure it. You'll be taking those treatments 2 years, 5 years, 10 years, 20 years. I've had so many people who really disabled for 5 and 10 and 15 and 25 years. We put them on our program. In 2 weeks, they could throw away their walker. And in a month, they didn't have arthritis anymore, didn't have osteoporosis anymore. Okay. Now, that's $626.8 billion just to treat the symptoms in the United States of arthritis. Now, let's look at osteoporosis, which is a more severe form and also affects the long parts of the bone as well as the joints. Okay. Osteoporosis. And let's look at a study that was done and published just a couple of years ago. The United States, Canada, and the EU, European Union, the 3 communities together each year spend $6.5 trillion. So it's like 2.2 trillion each one is spending, okay, just to treat the symptoms of osteoporosis, the pain and immobility and that kind of stuff. And when you add that to the cost of arthritis, you're looking at $7 trillion a year we're spending just to treat the symptoms of arthritis and osteoporosis in humanity. $7 trillion. Doctors love arthritis and osteoporosis. I repeat that. Doctors love osteoporosis and arthritis because that's one of their biggest sources of income. You look at diabetes, it's only $342 billion a year to treat the symptoms. Heart disease, $316.8 billion to treat heart disease symptoms. Obesity, $260 billion. cancer. You'd think it'd be wild. Well, it's only 190 billion. High blood pressure is 131 billion. Okay, multiple sclerosis is 85 billion, and kidney dialysis is 24 billion. Nothing by itself comes close to arthritis and osteoporosis. Okay, and these are simple nutritional deficiencies. And so again, we came up with a healthy bone and joint pack, which was our original Healthy Start pack, and the glucogel. And then we have the CM cream to apply to the joints, and then maybe 15, 20 minutes, the pain will go away. And if that's all you do is put that on once during the day, you'll get 3 to 4 hours of pain relief. Okay. Now it's not going to fix anything, but it gives you the pain relief. But you add that to your Healthy Bone and Joint pack and your 90 essential nutrients, the Healthy Brain and Heart pack, it all goes away. Why not let it go away? And if you become one of our members of our community in longevity, you pay a wholesale price, you get a discount. Okay. And it's one of those things where I really, really urge you to join us, become part of our family, and you will be blessed. You'll be blessed. And again, the book that we were showing. Okay. When you have osteoporosis of the skull, you're going to hold that up there. There you go.
Got it.
All I see is your right ear.
Well, remember there's other pictures that are ahead. So pull that down and you'll be able to see the whole us. Or don't worry about it and just have faith that I am here. Okay. So we've got us.
Open up,
yep.
Open it up to page 6. Open it up to page 6. There you go. And you see the bottom picture. The skull is 1.5 inches to 2 inches thick because it's got osteoporosis. The top picture is only 1/4 inch thick because it's normal. Okay. And it's one of those things where there's 12 pairs of cranial nerves that get squeezed when you have osteoporosis of the skull. The spinal cord gets squeezed, it's coming out of the back of the skull. And there's like 50 different diseases you get. Uh-oh, I've got an alarm going off. Let me have just a second here. I need 1 minute. I'll be right back.
All right. As Dr. Wallach is taking care of that, we're just going to go ahead and let you know how you can get a hold of Dr. Wallach's books. Now, he does have a bookstore online. It's at www.drjwallach.com. That is drjwallach.com, where you will find all of his book publications and also many, many of his audio recordings that have been captured over the years, put onto CDs. And there are a couple that are digital downloads, including some ebooks. For those of you who prefer ebooks, you can find those as well. Now, Dr. Wallach, as I mentioned before, this is how he does support himself and his wife, is through the sales of his books. So Dr. Wallach has done some amazing things in his 85 years, and I am honored to be part of what is, well, somebody that's been blessed by his research, by the formulas that have occurred from his research. And because they helped me is why I do what I do now. I've done a lot of things in my life. I've had some success, a successful career as a statistician, but folks, as a statistician, I was working in the quality returns department, and I vowed to myself that I would find a way to never need that medical device that we were analyzing, trying to figure out how it failed. And thankfully, I have found Dr. Wallach. I know exactly why people now were needing that device, the angioplasty catheter and stent. And I know how to help people not need it. And it's because of you, Dr. Wallach. And I am honored to be able to host you on this program along with many of our other health professionals and advocates who also have found the value and the benefits in your research and want to join this crusade in order to help others as well. And this is open to anybody and everybody, right, Doc?
Absolutely. And it's one of those things, you even have, a newborn baby become a member. Okay.
No, let's just go with the people that can,
do something. Yeah.
Yes.
Okay.
that can make phone calls and pick it up and learn. But yeah, there are options where you can help your kids, your grandkids start creating that nest egg. So it's an amazing opportunity, Dr. Wallach, and I'm so thankful that I've been able to find it and share your message.
Well,
Now,
thank you.
osteoporosis, osteoarthritis. What's the difference between the two?
Well, osteoarthritis attacks the joints. Osteoporosis attacks the long part of the bones.
Okay.
Okay, that's a simple way to describe that. And of course, one of my, like you say, I have 25 best-selling books. Let's Play Doctor. It teaches you how to diagnose these things. It's okay. I don't know how many languages it is. It's in 81 countries. Okay, 2
I think
languages.
this one's in 2.
Okay, so Let's Play Doctor. It goes into arthritis, osteoporosis, high blood pressure, diabetes, Alzheimer's disease. It goes into back problems, hip problems, digestive problems, heart problems, high blood pressure, diabetes, all those things. Teaches somebody, with to diagnose these problems and what nutrients to give. So we're very, very proud of this book. It just flies out the door every day.
And if I can interrupt you just a moment, Dr. Wallach. Again, folks, you can find Dr. Wallach's books at drjwallach.com. This program is not meant to take the place of your primary care physician, nor is it meant to diagnose, treat, or prevent any diseases. The FDA requires that I share that information with you. But folks, when you give the body what it needs, the body itself can do some amazing things, absolutely amazing things in being able to take the nutrition, create cells that are healthier and healthier. And when the cells are becoming healthier, instead of breaking down, what's going to happen? The worst thing that's going to happen is you're going to start feeling better, right?
Right. Let me interrupt
so
here for just a minute. Let me interrupt here for a minute. And you'd think that, we're America. We're America. We should have the best health care in the world. We should have the best health in the world. We should have the longest lives in the world. Not even close. Our average lifespan.
Yeah, the most expensive.
Yeah, in the 70s, in the low 70s, 73. It goes to 73 in the white community, down to 68 in the black community, okay, in the United States. And it's one of those things where I think it's Pakistan, okay, that have the longest lived peoples on Earth. I think it's Pakistan. But anyway, it's the Hunzas in the Himalayan mountains. And their average lifespan of their entire community, these Hunzas, okay, is 120. Many of them live to be 122. Many live to be 150. Many of them live to be 200. Jean Calment from France in 1994, I believe it was. She died in France at 122 years and 164 days. And they had all these scientists from all over the world come and examine her body and her food she was eating and this and the other. And it was correct. She lived to be 122 years and 164 days. Okay. And she's from Canada. Oh, excuse me, she was in Canada visiting, but she's from England, is where she's from. Okay. And so, or France, she's from France. Okay. And so it's one of those things where you're throwing your life away if you're not paying attention to those details. Another one of my books that's really useful here is Rare Earths Forbidden Cures. It tells you how to get a hair analysis and how to interpret it and so forth. Rare Earths Forbidden Cures. That book really is, what should I say, underused. It goes into about 40 different diseases that are from primarily mineral deficiencies. And it's one of those things where it's an underused book that will tell you how to do a hair analysis, show you how to interpret the information you get. And so thank you for that. We really love that book. Okay. And then we have the metabolic syndrome. which goes back over 2 million years ago. Okay. The book doesn't go back that far, but the disease goes back that far. The disease goes back farther than that. It goes back, like 20 million years, 30 million years. Okay. And it's metabolic syndrome is abdominal obesity. Yeah, there you go. Abdominal obesity. And you're talking about also the diabetes and high blood pressure. When you have those three things, you have the metabolic syndrome. It's easily gotten rid of in just a few weeks. Very simple disease. It's not genetic, but doctors tell the patients, oh, this is a genetic thing. You'll be dealing with this for the rest of your life. So you come in every month and we'll kind of see what's going on and adjust your medication, and anything new comes along, we'll put you on it. And so when you talk about these types of diseases, the medical profession is how they make a living. That's how they drive expensive cars. That's how they send their kids to college. That's how they buy a big house, that sort of thing. And then another one that's useful is Dead Doctors Don't Lie. We have people every month, they buy cases of this book. Okay, there you go. Dead Doctors Don't Lie. And right in the upper right-hand, it's the upper right-hand corner. Yeah, when you're looking at the book, yeah, the upper right-hand corner, it tells you truthfully, at that moment, we had sold 20 million copies of my CD of the lecture that I gave at the same title, Dead Doctors Don't Lie.
350 million, Dr. Wallach.
No, that's the books, but the CD is 20 million.
It said audio tapes sold worldwide.
Yeah.
350 million Dead Doctors Don't Lie audio tapes sold worldwide. And that does not include all the CDs that have been sold, Dr. Wallach, or the books. So my signed edition of this book was copyrighted in 2016 when the book was originally written in 1999. So Dr. Wallach has been sharing this information for more than 24 years just through this book. And that doesn't include all of his years on the road giving lectures before he even had the exact products as a solution. And I think that's fantastic, Dr. Wallach, that you put together a team, came up with products that you were comfortable with, that actually delivered the solutions to all the things that you were lecturing about. And here we are today, helping millions of people around.
And another couple just quickly, Hell's Kitchen. Let's see here. Hell's Kitchen was published in 2004, I believe. And it's one of those things where it goes into all of these terrible diseases. Okay, read chapter 14 in this book. It goes way, way back, thousands of years ago. Okay, chapter 14. And then a companion book, Immortality, came out in 2008. And again, you want to read chapter 11 here, and it goes back 200,000 years ago. 300,000 years ago in chapter 11, and goes into the cavemen, okay, and the diseases they had. They were just simple nutritional deficiencies. And then at 3 o'clock in the afternoon, Monday, September 4th, 1882, and they flipped the switch, we went to electricity. Suddenly now we went to 600 different diseases from nutritional deficiencies instead of 5 or 10 or 20, whatever it was, okay? And so these bits of information are available to you. They're priceless. And these books, we're talking about, if you buy 10 of them, you get a nice big discount. And I got guys that come, I don't know if they have a bookstore or a big longevity business. I'm not even there when they come. And so they come and they buy cases of 2 or 3 titles of my books, 2 or 3 books, cases, okay, a couple of times a month. And they're flying out the door because people read this, say, oh my gosh, I mean, it's worth trying. And then they come back and say, I need another 10 of those books. Well, how'd it work for them? It worked great. That's why I'm here getting 10 of them. I want my family to have them. And the holidays are coming up, and I want to be able to give away these books okay, for holidays. I want to be able to help people lose weight, get rid of their high blood pressure, get rid of their diabetes, get rid of their metabolic syndrome, get rid of their arthritis, get rid of their osteoporosis, get rid of their heart disease. And then we came out with I-26 to get rid of things like Alzheimer's disease, Parkinson's disease, multiple sclerosis, amyotrophic lateral sclerosis, ALS. We get rid of all these diseases. These are not something you get when you're old age and you're doomed to have it for the rest of your life and it'll shorten your life. No, these are simple nutritional deficiency diseases, and we figured it out. And we came up with programs that are available. And when you become a member, you pay wholesale prices for these things. We have a flip chart, 90 for Life Crusade to save humanity, okay, and save the world. 90 for Life Crusade to save humanity and the world. And there's like 50 different diseases you can prevent. And I like the chewables. I like the French vanilla chewables. I'm still a kid, but we have the healthy, there you go, the powder, we have the capsules and so forth, the I-26. And it's one of those things where doctors only treat the symptoms of Alzheimer's disease, Parkinson's disease, multiple sclerosis. And in this flip chart, we have famous people, okay, who had these diseases, famous people. We have everyday people, school teachers and this kind of thing, who had these diseases. And we tell their stories. One of my favorite ones, of course, and she's featured here, is Madeline. Oh, her last name begins with an O, and we just didn't give her last name because we didn't want 1,000 people on our front lawn every morning. Okay. But Madeline O had Parkinson's disease for, I don't know, 9, 10, 12 years, whatever it was. 11 years.
So 11 years she had been diagnosed with having the symptoms related to Parkinsonism. And one of our coaches, who she was going to for different therapeutic things, recommended your program, Dr. Wallach. She got on the amount of program that she was able to afford. And in 2.5 months, when she had that 12-year checkup, she no longer had those symptoms that had diagnosed her or given her that label of having Parkinson's. And she is just ecstatic, so thankful, Dr. Wallach, for the programs that you've put together, the products that you have provided. And she agreed to allow us to use her as a published case study to share the power of nutrition. So the I-26, Dr. Wallach, you had mentioned the doctors treat the symptoms. Are they really treating symptoms, or are they masking the symptoms?
Well, that's just, I guess, two different words that kind of point their finger at the same thing. Treating symptoms can mask the symptoms. I didn't say cure the symptoms. I said treat the symptoms. Because when you get a painkiller, you're not solving the problem. You're just killing the pain. Okay, so you're treating the pain, okay, and relieving the pain. And the patient is happy. They're just, man, I had pain for years. I mean, I was crippled. I just couldn't get out of bed. And this new drug came out, and the doctor called my family up and had me come out there. And it's just great. I don't have that pain anymore. I can sleep at night. Well, that's good. That's a good thing. But it didn't solve the problem completely because it didn't get rid of the disease. Okay, just solve the symptoms.
Just solving symptoms. Well, Dr. Wallach, we have lots of people with questions. So we've got people with their hands up. We've got people that are texting in the questions off of YouTube, Rumble, Facebook, and also here live in our Zoom room. So folks, as you're listening and you think of somebody that is afflicted with some of the things that we're talking about today, please make sure that you share this program with them. Let them know that there are options. There is hope, that they don't have to continue down that road of the body continually breaking down with no U-turns. There's definitely U-turns. Well, get back with the person that shared this program with you. And if there is no one to thank, make sure that you give us a call at 855-949-3377. If you have questions that we don't get to in today's program, you can email us questions@dailywithdoc.com. And if you're interested in joining us on this journey and you're not working with anybody, feel free to give us an email at info@dailywithdoc.com or the same phone number, 855-949-3377. Well, Dr. Wallach, our first question is coming from Herbie over in Ireland. Herbie, go ahead and unmute yourself if you would.
Hello.
Hello, hello.
Hello.
How can we help you?
Hi. Good to hear from you, Dr. Wallach. I first heard about you a couple of weeks ago on the Charlie Ward show.
Yes.
And
Yeah, we actually have a big what should I say, tool that we're making from the Charlie Ward show. Okay, and that'll be available in the next couple of weeks. So thank you. That was really a great experience. Charlie Ward and his team, Lewis, really did a great job. They're famous all over the world.
well, Dr. Wallach, it's a pleasure to get speaking to you because I've been waiting for somebody like you to come along for years to possibly help my wife. She's got Huntington's disease, and we live in Ireland, and I know I can get the stuff in the UK, but I don't know what stuff to get and what order to take the stuff. If I could get, someone could explain what to take and what
Okay.
product to buy.
Okay, how old is your wife and how much does she weigh?
My wife is age 60, 61, and she's 9.5 stone, so about 130 pounds, would that be?
Okay, close enough, 135 pounds. Okay.
Yeah.
She's get rid of all the bad stuff. No fried foods, no processed meats, no oils, no glutens, no wheat, no barley, rye, oats, no buckwheat, no sugar, no carbonated drinks. Even the diet ones got to go. Carbonation neutralizes stomach acid, so you cannot digest food or absorb minerals. And then at 130 something pounds, she needs 2 healthy brain and heart packs per month. 2 healthy brain and heart packs per month. Okay. It's very, very important. Does she have any ringing in the ears or tinnitus, buzzing in the ears, or balance problems?
She has a balance. That would be our biggest problem, Dr. Wallach.
Okay,
Would be
good.
our
Huntington's chorea, yeah. Okay, yeah, okay. So, and you need to get the book. You need to get the book. It's called, It's All in Your Head. Okay. And each chapter of the book represents one of the cranial nerves. And when you have what your wife is having, okay, she got 2 things going on. Huntington's chorea, Huntington's disease, she's losing the white matter of the brain, the myelin, the white matter of the brain, the spinal cord is going away. And then she has other things going on. So what are we going to give her? Well, 2 healthy brain and heart packs, 1 full dose of breakfast, 1 full dose of dinner. She also needs the Ultimate Daily Classic tablets. Ultimate Daily Classic tablets. I weigh 142 and I take 3 of those twice a day. They will support healthy blood flow through blocked arteries. They'll support healthy function of the kidneys, the heart, the liver, the brain, the lungs, muscles, bones. That's the Ultimate Daily Classic tablets. Very, very important here. And then she also needs the, let's see here, I'd go with the I-26, and she needs, I'd go with 3 doses a day because she's got clinical symptoms. Wouldn't hurt to get the flip chart. And on page 27, yeah, 27, the flip chart, it goes into the, let's see here, multiple sclerosis, but that's very close to the Huntington's chorea, okay?
So on these different pages, it is showing information about the different conditions that are associated with demyelinization, which is what is a leading cause of many different neurological conditions. Is that correct, Dr. Wallach?
That's correct. It's just, where you have the worst, serious deletion of myelin, the white matter goes away in the worst places. That's the disease you get, okay? And so it's the same disease, it's just you get different symptoms based on the location of the worst deficiency. And in this, the value of this flip chart is you understand what's going on, but also there's a section with famous athletes, famous movie stars, famous politicians, famous billionaires, famous people all over the world for various reasons. And they had these diseases, including Huntington's disease, Parkinson's disease, Alzheimer's disease, multiple sclerosis, ALS, and these all go away when you treat them properly, and that's why I take the three of the I take three of the
I-26.
Yeah, I take three of the I-26 at least twice a day. If I'm going to be going outside and doing something, really unloading a truck or loading a truck or doing something, chopping up a tree or something like that, I'll do 3 doses a day for a day before, during that day, and the day after. Okay. You want to make sure that all your tissues, including the white matter of the brain, get supported. Doctors didn't know that when they started naming these diseases, but each of these diseases have a very serious loss of the white matter, myelin, of the brain in that location. And you can see that at the autopsy, okay, and look at the slides under the microscope. But the doctors still today, they think it's a genetic thing, okay? But they're coming around because we've done this for so long now. It's a couple of years, and they're starting to talk about this in the newspapers. And so doctors are saying, well, if they're talking about this in newspapers and things are happening, let's find out what's going on here. So we're starting to get contacted by medical doctors and nurses and pharmacists and so forth. So we're very, very happy that we're going to get this information out through a broader base of people.
Okay.
Absolutely. Thank you so much. And Herbie, yes, you can get the majority of these products in Ireland as you are part of the UK. Longevity does ship directly to those in the UK.
Could I be cheeky and ask, could that be sent to me in email, just what Dr. Wallach had said, so I can get it in the right order?
Yeah, if you could, Herbie, if you could email us at questions@dailywithdoc.com, and we will get this recommendation from Dr. Wallach emailed to you with the dosing. Okay, so thank you so much for joining us all the way from Ireland. Now we need to go to the next question. And Dr. Wallach, I have a woman. She is 47 years old. She's had part of her colon removed. She has some mental illness going on. She also has sleep issues, and she's constipated, Dr. Wallach. So 47 years old, and she's only 123 pounds at 5'4". What would be your recommendations?
Okay, her main complaints are
I mean, she's got she's constipated. She's had part of her colon removed. She has major gut issues.
Sleep problems.
And mental illness.
Okay, so let's go from there. She and everybody in her family need to get rid of all the bad foods, none in the house, so she can't sneak them. Okay, no bad foods. No fried foods, no processed meats, no oils, no gluten, no wheat, brown, rye, oats, no buckwheat, no sugar, no carbonated drinks. There you go. That's in the back of which book?
Metabolic syndrome.
There you go.
We have good foods, bad foods list right on the back, easy to find.
Okay, and that's the book, Metabolic Syndrome. Okay. And at 147 pounds, she needs to take 2 healthy brain and heart packs per month. 2 healthy brain.
She's 123 pounds. Does she still need to?
Okay, she's kind of close there, but she's got 3 major diseases. So let's go with 2 healthy brain and heart packs per month. A full dose of breakfast, full dose of dinner time. She needs the Ultimate Daily Classic tablets. Take 3 of those twice a day. That's going to get blood flowing into the brain, into the heart, into the kidneys. We also want her to have, let's see here, She needs the I-26. She needs to go with 3 doses a day, the I-26, and she can have the she can have the chewables. Okay. She can have the capsules or the powder. Either way that you get them, I like the chewables. I take the chewables. And this, I've seen so many people, literally by the hundreds, and we're getting information by the thousands where people had all kinds of stuff going on with their brain and spinal cord, myelin issues, sleep issues, things going on with her other organs, the heart and the kidneys and the liver and the colon. And it's one of those things, you get rid of the bad foods, which cause the problems to begin with. And then, of course, when you have deficiencies, it makes it really bad. So you have to make up the deficiencies and stay away from the bad foods. And the body has an enormous capacity to rebuild and heal. So give us a call every couple of weeks. Let us know what's going on, because we'll walk you through this, and the odds are everything will work out.
Absolutely. And to extra help for the sleep issues, Longevity has put together a trio of includes the sleep gummies, which are really yummy, and HGH Youth Complex, which are the precursors for helping your body create that human growth hormone, not artificial hormones, but it's supporting the body in creating its own human growth hormone. And also OsteoMag, which helps to relax, but not just relax, but is OsteoMag. So you've got things to help support bone strength, and then the magnesium to help you relax. So a great system that Longevity has put together to help people, because sleep is a major issue, Dr. Wallach.
That is correct. Rest is very important for adding many healthy years to your life.
Absolutely. Next, let's go to Ruth Ellen. And Ruth Ellen, let me go ahead and get you up here. Go ahead and unmute yourself. What questions are you bringing to the table today?
Okay, so hi, Dr. Wallach. I have several questions from YouTube. I have Joe Smith. I do not have any weight or height or anything. He says he has a tooth abscess and is on antibiotics. He read that I'm not supposed to take my nutrients until I'm finished in 1 week. Is that true?
Okay, I missed. He says he's got a tooth problem.
He has a tooth abscess, and somebody told him he wasn't supposed to take any of his nutrients. And he's just clarifying, is that true?
Okay. There's nothing wrong with taking supplements. Okay. The good Lord built us to utilize these nutrients to maintain our body and to repair our body. Okay. They're not going to interfere with any prescription medication.
Okay. Thank you. And then Mickey Pastor, he says, hello. Recently I have been breaking out in hives. Looks like a chemical attack. The doctor gave him prednisone and Zyrtec. It's not helping. Zero change. He hasn't changed his diet or his detergents. And he's been taking the 90, I-26, Tangy Tangerine, and Osteo.
Okay, you have to look up at me because you're looking down, and all I heard is.
I'm sorry. I'm trying to read at the message. Okay, so he has been breaking out in hives, and he has. It looks like he's been attacked chemically. The doctor gave him prednisone and Zyrtec. It's not helping. He hasn't changed his diet, his laundry soaps, or anything like that. He takes the 90, takes I-26 and Tangy Tangerine and Osteo. Is there anything else that you may recommend to?
What's his problem?
Hives.
Hives. Oh, okay. Yeah. Hair, skin, and nails.
Okay.
Hair, skin, and nails. You go ahead and take it. How much does he weigh?
I don't have any of that information.
Per 100 pounds would be 3 twice a day per 100 pounds. Okay. The hair, skin, and nails. And again, the I-26, you say he's already taken that. And but getting rid of the bad foods is very important. No fried foods, no processed meats, no oils, no glutens, no wheat, no brown rhinos, no buckwheat, no sugar, no carbonated drinks. Even the diet one's got to go. And this will be for life, okay? Not just for a couple of weeks, but also, again, the hair, skin, and nails, but also we have, it wouldn't hurt to throw in, we have the herbal rainforest. The herbal rainforest is a great mix. It has 15 cleansing herbs, gets rid of bad stuff out of your body, 15 cleansing herbs, but it also has 75 plant-derived colloidal minerals. Okay, now you don't want to take too much because it'll give you diarrhea, okay, because of those 15 herbs. So just use it by the weight based on the label, okay? Herbal rainforest. And you can have, I take it like once a week. I'll have a dose in the morning with breakfast, dose in the evening with dinner time, but I'll do that just like once a week. I don't do it every day, okay? Because I don't want to have to be running to the toilet all the time.
Right.
But okay, so that helps get rid of bad stuff coming in that you don't know what's in the food that you're getting from the grocery store. You have no earthly idea what's in there.
Very true. All right, and then I have Donna, no weight or anything on Donna. These are sent in on YouTube, and sometimes we don't get that information. So Donna asks what to do for her friend who has cancer and is losing her hair. Any recommendations?
Okay, well, it wouldn't hurt to get a hair analysis. Okay, get the book, Rare Earths Been Cured, get a hair analysis on this person and find out if there's bad things in there, because the hair analysis will show you toxic metals, like lead and mercury and stuff like that. Okay.
Yes.
So that's a valuable piece of information, but it'll also tell you what deficiencies are there. And so at this point, need to get a hair analysis, that's for sure.
Okay, thank you. And after reading that, if she's on chemo, whatever chemo treatment she is on could be causing her hair to fall out. And there's really not a lot that you can do for that. And then AJ, did you want to ask the next question? Okay, go for it.
Okay. Thank you so much. Keep us informed. Let us know what's going on, how these things are working out, and if there's other questions as we go. But don't give us a call every week or so. Okay.
Thank you, Dr. Wallach.
Thank you. Okay, we got time. Looks like for one more.
A nice and easy one for you, Doc.
Okay.
Beach Time mentions that they were diagnosed with sarcoma malignant peripheral nerve sheath tumor. They had a procedure that removed the tumor, and they said it's very likely it will come back. And this malignant tumor is aggressive in the soft tissue sarcoma that develops in the protective sheath around the nerves. You kind of always talk about that myelin sheath. What can they do to try and prevent it from coming back, given that they say it recurs?
Okay, well, you need the immune system working here. Get rid of all the bad foods, no fried foods, no processed meats, no oils, no glutens, no wheat, brown rhinos, no buckwheat, no sugar, no carbonated drinks. The diamond's got to go. And then they need one healthy brain and heart pack per 100 pounds of body weight. If they weigh 140, 150 with those kind of things, I'd go with 2 healthy brain and heart packs per month, a full dose of breakfast and dinner. And then again, the I-26 supports the immune system. The number 26 are the number of diseases that this particular product helps go away. Okay, so it's a very, very good immune supporter, the I-26. And for somebody, they want to use, say, 2 doses a day per 120 to 130 pounds, 2 doses a day for the I-26. And let's start there, plus all the nutrients we talked about. Okay, Ultimate Daily Classic tablets. Let's see here, our Healthy Brain and Heart Pack. And let's go there, okay?
Yes, sir. Thank you, Doc.
You bet. God bless, and thank you for all the good work you do.
All right. Thank you, team. And if we could get the team up, Dr. Wallach, Ms. Cook was saying that she remembers that you have been lecturing the Dead Doctors Don't Lie talk since the early 80s, which I recall as well. So even before your book came out, Dr. Wallach, you have been talking about how dead doctors don't lie. And why? Share with us really quick. Why did you call that book, that lecture, Dead Doctors Don't Lie?
Remember, I worked my way through veterinary school, naturopathic school, in the pathology laboratory. I'm seeing all the dead bodies, some of which were not due to doctors' mistakes, but many of them were due to doctors' mistakes. And so when you see all this stuff, then you're looking at the recommendations that were given to the patients. And in many cases, it didn't fit. They were not giving the right advice to the patient for the disease they had. And I was just a student. Okay. And so I'm looking up what they should have gotten. And so I collected all this information. And what should I say? It's one of those things where the information was very well received in my lectures. And so somebody said, well, why don't you put it in a book, Wallach? So I put it into a book. There you go. You got it. And what does it say on there? How many have we sold now?
Well, for the 350 million Dead Doctors Don't Lie audio tapes sold worldwide. And again, that was on this edition that was published in 2016, so 8 years ago. And it's been a lot more since then, Doc. Now, I know, Rod, your hand was up. It went back down. Now it's back up. Did you have one final question for Dr. Wallach?
Yes, I had a text message for a female, 5'4", 190 pounds, and she had plantar fasciitis.
Pancreatitis?
No, plantar fasciitis, Dr. Wallach, connective tissue.
Okay, plantar is on the bottom of the foot.
Yes.
Okay, well, get rid of all the bad foods. Per 100 pounds of body weight, 1 Healthy Brain and Heart Pack. Needs the Ultimate Daily Classic tablets. Go ahead and take 3 of those twice a day. Needs, you can, for pain, use a CM cream topically on where it hurts. And then, of course, we have the, I'd go with the extra glucogel. Take 3 of those glucogel 3 times a day. It probably, you want to make sure and ask the question, do they have ringing in the ears? Do they have balance problems? Because it could be the skull squeezing the spinal cord nerve called the 10th cranial nerve, the vagus nerve. Okay. And that runs all the way down to the toes and causes problem, the toe problem, but it's really happening up here at the top.
Well, and plantar fasciitis was one of the things, Dr. Wallach, that I no longer have to deal with since getting on your program. So one of the many things that I had labels of. Well, folks, we are at the top of the hour. Thank you so much for joining us here on Daily with Doc and Becca. As a team, we are honored to be able to bring this program to you, as it does take more than one person to make all the pieces happen. I just want to do a shout out and a thank you to you, Dr. Wallach, for starting this crusade and giving us something greater than ourselves, an amazing purpose in helping others and helping you help others around the world. I also want to do a shout out, and first we're starting out with him, AJ, who has helped us get on all the different platforms so that we can reach more people. Thank you so much, AJ, as our digital marketing director. Is that what we decided he is? Whatever. So thank you, AJ. And for Rod, one of our certified holistic health coaches who is helping bring in questions and also keep an eye on everything. Thank you, Rod. And Ruth Ellen, my executive production manager, who's helping to keep us all organized and make sure that we're all here, including keeping our lineup of guests flowing. So I'm super excited for all that we have coming. We've got some new stuff coming, folks. You're going to be excited for it as well. I want to thank Sherry, as she's part of our tech crew, who keeps making the stream set up. She helps with the setup so that we can keep the stream going. And Ruth Ellen actually is pushing the stream out to different locations. So there's a lot of moving pieces here. We have Marilyn, who is doing dictation and is putting the notes into the chat. So folks, if you're not joining us live, you're missing it on that chat.
What about Africa? What about Africa?
I'm not there yet.
Oh,
I'm not going to forget Albert. I'm not going to forget him. But Marilyn is putting that information into the chat. That's only available when you are here live with us for privacy and protection of our guests and those asking questions as well. So thank you, Marilyn, for all you do. And last but not least, we have Albert down in South Africa with his buddy Marty, who is actually a zebra that was photographed in his own backyard, which I think is absolutely fantastic. Thank you so much, Albert, as it is now at 10 o'clock your time in PM. He is here at all hours of the day helping people and making sure that we are getting information out. So we couldn't do this without the team. We don't have everybody here with us. We're able to rotate as people are available and not available. And there's room for others too, not just on the Zoom team, but our team is hundreds of people, hundreds of coaches who have gone through the Certified Holistic Health Coach course, learned about all the different nutrient deficiencies that affect those 4 areas of health, plus what we can do to help the body as a whole, mentally, physically, spiritually, even have an optimal life and help others find it as well. So please make sure you go to coachwithdoc.com, all one word, coachwithdoc.com. You'll find more information about our Certified Holistic Health Coach course. Get back with the person that shared this program with you and say, hey, I need the 90, or I want to be part of the solution, and let them help you get set up. Again, if there's nobody to thank, give our team a call at 855-949-3377. My name is Becca Dukes, and thank you so much for investing this hour of time into you and your family. We invite you to give us 90 days. You can go to dailywithdoc.com. If you're not working with anybody, you will find the 90 essential nutrients in our store there. Plus, you'll find replays of previous programming and articles to help you on this journey, and the good foods, bad foods list. Sign up for our email list so that you don't miss a thing. We promise we do not sell your information or share it to any third party. It is all kept in-house. As you trust us, we want to make sure that we don't do anything that is going to compromise that trust. We are here for you. Until next time, bye for now.
Bye-bye.
Oh,
Eddie Best says, talk since.
Yes. And folks, we have Daily with Doc. Daily with Doc also powers another program called Pharmacist Bin Bites that is hosted by Coach AJ. And we have more programming that is coming up, as well as, folks, there's so many different personalities and people that we as individuals can reach, where there's people you can reach that I can't. We invite you to be part of this crusade so that we can reach more and more people and help them find solutions. And you're welcome, Carol. Carol just sent in a message. Thank you for all you do. We appreciate you all. Until next time. Bye for now. This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences, and the individual results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach. This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences, and the individual results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach. This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences, and the individual results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach.